Thanks, John. Next, we're going to turn towards hip osteoarthritis and some of the common causes of hip arthritis. And we're going to start with Module 3, Question 48, which I think everybody has seen. And let's see if we can get this to move. Which of the following is characteristic change in cartilage involved in moderate osteoarthritis? And I'm assuming you all have done these questions, and I think the way these questions are worded, there's one that's clearly wrong, and all the rest of them are usually things that do happen, and I think it's just a question of staying alert for that. And so the correct answer is a little paradoxical, but you actually increase water content in moderate osteoarthritis because of some of the disruption of the cartilage matrix. And I think everybody probably understood that. The other things that you see are that you actually increase chondrocyte activity in moderate osteoarthritis, which is another thing that doesn't make perfect sense. The other three, I think, you all are well aware of and makes perfect sense. The epidemiology of hip osteoarthritis is it's a third as common as knee osteoarthritis, whether we'd see a question, and that they're both modifiable and non-modifiable risk factors, and repetitive trauma and increased weight are certainly things that fall into modifiable activities and things we do every day trying to treat our patients. It is more common in females than males. I think you could see a question on that. I like this table in the top right. There are a few things that are differences between normal age-related changes and osteoarthritis. The water content we've already talked about is decreased in aging and increased in osteoarthritis, and also the modulus of elasticity is increased. It becomes more flexible in aging and decreased in osteoarthritis. It becomes stiffer, as you all know. The synovium in late phases of osteoarthritis becomes increasingly thick and vascular, and the edges of osteoarthritic cysts are different than those in rheumatoid arthritis. They have sclerotic edges due to the relatively slow nature of the inflammatory process, which differs from rheumatoid arthritis. I think you might see a few questions on how cartilage gets destroyed, and the proteolytic enzymes, the MMPs, matrix metalloproteinases, are important. These three that are mentioned, strombolisin, plasmin aggregatase, are ones that have been on questions. I think you also need to know that the inhibitors of these MMPs are the TIMPs, the TIMPs, and that osteoarthritis is believed to be due to an imbalance between MMPs and TIMPs, TIMPs. The inflammatory cytokines are probably familiar to all of you because of the osteolysis literature. They're interleukin 1, 6, and TNF-alpha are commonly implicated in destruction of bone and osteoarthritis.
If you enjoyed this video, please consider leaving a like. We'd love to hear your thoughts and what you'd like to see next in the comments. Don't forget to subscribe to our channel and follow us on social media.